If you're on Social Security disability, you have a 2-year wait for most people before they put you on Medicare. They automatically enroll you on Medicare. Unless you have Lou Gehrig's or you need a transplant, you have to wait 2 years. And then when you're at your 2-year mark, you're like, okay, let's go. I've waited 2 years and I either had to pay it out of my pocket, which was very expensive, or perhaps you were on your spouse's plan, but you are ready for Medicare. You're like, let's do this. Well, if you live in one of these red states, you are not going to get a Medicare Supplement plan. Now, you probably want a Medicare Supplement plan because you're disabled, because you have a lot of health conditions. Not always, but I would say 99% of the people that come to me with disability, I would recommend they go with the Medicare Supplement plan. No networks to contend with. They can go to any doctor, any hospital in the country. And let's say you're on dialysis. If you bought a private Medicare Advantage plan, you'd pay 20% out of pocket every time you got that dialysis. That's expensive. If you had a Medicare Supplement Plan G, once you meet your annual deductible, you wouldn't pay anything for your dialysis for the rest of the year. So typically, you're going to be better off financially on a Medicare Supplement plan. And a lot of your friends have told you that. So you call us and you're like, we want a Medicare Supplement plan, and only to find out that if you live in a red state, they are not available to you until you turn 65. That is because the insurance is determined by the state Department of Insurance. And it's crazy different, as you can see, in all 50 states if you watch my other videos. So let's say you live where I live. I live in Indiana and Florida. So when I'm in Indiana, my Indiana clients that are turning 65, they can get any plan. I mean, anybody can get any plan at 65. But if they're under 65 and they're on disability, I'm going to recommend a Medicare Advantage plan, which is fine. But I'm going to warn them that they're going to have a window when they do finally turn 65 where they can get a second shot at Medicare supplements. They can get any plan from any company, regardless of their health. And most people, when they turn whatever, they're on disability and they turn 50, they're like, 65 is so far away, I'm never going to remember that anyway, and they forget. And it's a one-time window. Now, I also live in Florida. Florida's no problem. Florida's a very good state because of Alonzo Mourning. He used to be a famous basketball player. He got something passed called the Alonzo Mourning Law because he got disabled, and he found out this was happening to disabled people. So thank God he was very active. So now Florida not only allows you to get a Medicare supplement when you're under 65 due to disability, but they don't let the insurance companies charge you more than they would charge a 65-year-old. That's the other gimmick. So in all these gray states, if you live in one of these gray states, you're like, oh, good, I'm in a gray state. I can buy a Medicare supplement. I'm so lucky. Most of the time, no. Most of those states, they legally offer you a plan, but they allow the insurance company to do whatever they want. And what the insurance companies do, I don't know if you've ever noticed this, but they do something a little evil. And that is they will charge you exorbitant prices for that. So high, you couldn't afford it. So even though it looks like most of the country, you could get a Medicare supplement under 65 on disability, no, not really. But there are a few states like Florida that you truly can at reasonable price. Okay? So that's what I'm saying. Sometimes they make you pay so much more that even though it's available, it's not even an option. So when you find out you're in a state like Indiana that it's not even available, you're going to choose private Medicare Advantage, a PPO or an HMO plan until you reach age 65. Now, when you reach age 65, that's when you have that second opportunity, basically like to re-enroll in Medicare. You're not really re-enrolling, but they're giving you a chance to come in again as every other 65-year-old. Every other 65-year-old can get any plan from any insurance company, regardless of their health. And that's you again, even though we know you have a lot of conditions, even though you've been on Medicare for 5 or 10 years, right? So this is a very important window. My primary job is I train insurance agents for a living, and I can tell you from training thousands of agents in all 50 states, most agents are unfamiliar with this. So unfortunately, they don't advise their client, hey, we want to get you into a Medicare supplement plan at 65. So I'm glad you're doing your own research and you're watching this video. It is called a second initial enrollment period, a second IEP. If your insurance agent doesn't talk to you about it, get a new insurance agent. Or you could work with us, my family, 3 generations, my beautiful parents and my son. We work in all 50 states. We are licensed where you are. We would love to help you. Like I said, we're especially passionate about helping people under 65 on Medicare due to disability, just because they get lost in the cracks. If you just have a question, you want us to untangle your problem, call us for a free consultation. Go to our website, themedicarefamily.com. Little yellow box at the top, book your own appointment. Or if you actually are getting ready to go on Medicare, you're on disability, you've been on it for 2 years and getting ready, call us ideally 3 months in advance. But if not, okay. Or if you're getting ready now to turn 65, ideally call us 3 months before you turn 65 and we'll help you with your decisions. If you like this video, you might really like this video. Check it out. And we'd appreciate if you subscribe to our channel so you never miss a great video. We put out one every week. Check in the description below this video for a link to our cheat sheet on Social Security and Medicare. And you can also give us a comment if you have a specific question. Always feel free to call us or email us at the Medicare Family.